Hello, good afternoon. This is Dr. Scanterberry, and I'm here with Dialysis Patient Citizens Educational Center, going live. Ask the Doctor. It's Wednesday afternoon here in Wilmington, Delaware. That's where I am. It's a rainy day, but I hope each and every one of you are having a good time. So thank you for logging on. Please send a little text to your friends so that they know that they can come and join us this afternoon for this open session of Ask the Doctor. We can talk about anything that you want to discuss, and hopefully we can engage in some topics and how to stay healthy, making sure that for those of you who are on dialysis, if you're struggling, feeling discouraged because you have not gotten on the list or you have not gotten called for transplant, understand that it's a process, but you want to make sure that you're doing all that you can to get you there. For some patients, there are oftentimes somewhat delayed in getting their information done, or they're too tired, but we want you to persevere. So thank you for joining Jennifer and Alethea from Michigan. Thank you for being the first on for the session. Welcome everyone. Again, I'm Dr. Scanterberry. This is your Ask the Doctor session, and I am here in our clinic as I'm now seeing patients now that I'm not practicing transplant anymore, but I am taking care of a lot of transplant patients. I do have a medical clinic, and so I still see patients in terms of getting them on through the process of either evaluation, making sure they understand what their choices are, because that's an important thing. You know, many patients end up on dialysis because they were unaware that they were stage 5 or stage 4, heading to their stage 5. Many patients may acutely show up with stage 5 and need to be on dialysis and not understand that it's a process. They may be on dialysis before they get information about transplant, but they should really talk to your healthcare provider about what your options are, even in terms of considering living donor transplant, looking at, can I avoid dialysis if I have a relative or a friend or someone who can donate to me? And also when it comes to dialysis, knowing your choices. Not everyone is a hemodialysis candidate or may do better with other options. Some patients with heart disease, dialysis is very difficult, especially hemodialysis. Older patients, is home dialysis an option? Is peritoneal dialysis better for some patients, especially as they get older? For people who may need to travel, there are some benefits of one over another. And this is information that you can obtain and that you have a right to receive in terms of knowing what your options are. So you can consider the benefits of what treatment is best for you. Again, thank you for joining, Linda and Judy. Thank you for joining on us. This is Dr. Scanterberry. I'm here with your Wednesday session, Facebook session, Ask the Doctor. So we are just talking about dialysis, being diagnosed with stage 4 or 5, needing urgent dialysis, not being aware. One of the things that that is an advantage for people who get diagnosed early and then have a lot of information under their belt is a process that they can think about as they are in stage 3 and stage 4. They're then knowing that down the line they're going to need to be dialyzed, and that allows for preemptive transplant, because now they have time to say, okay, I have 6 months, 8 months, however it may take a little bit longer. Perhaps I have someone who's willing to donate, and they can work on having that donor evaluated, go through the process, and avoid transplantation, because there are steps and they're ahead of the game in knowing that this is coming down the line. And so by avoiding transplant, avoiding dialysis, many of those patients do so much better because one, they have time to learn, they have time to adjust, and they can then move from being in stage 5 straight to having a kidney without the downside of hemodialysis. And because they're receiving a living donor, even if they get on the list early at stage 5, before they need to before they need to hit dialysis, and you have to understand that not everyone who is on the list is on dialysis. So for many patients, though they may not be vary from center to center, you can get on the transplant list long before you hit dialysis. So you may have an eGFR of 20% or less. That qualifies you to get listed for transplant. And you can begin to accumulate time even if you're not ready for transplant. You may still be feeling good. You may feel, you know what, I'm not quite there yet, but you can be accumulating time, because once that clock starts ticking, there are patients who can be listed for many years, but the creatinine clearance remains stable. They're still feeling well, and therefore they're not feeling like there is the benefits of transplant outweigh the risk, because they're not having many symptoms, so they're not seeing, they're not feeling like there's anything to improve on. So that's where for many of those patients, they will say, okay, I will stay on the list inactively and I'll wait until, or I may even go actively, but allow for me to turn down what I see may not be a suitable candidate for me. So thank you so much for joining, Yolanda and Cecile, who are watching. Thank you for coming on. Again, this is Dr. Scanterbury. I am here with this session today on Wednesday, May 15th, for the Ask the Doctor session here on Facebook, representing Dialysis Patients Citizens Educational Center. So thank you all for joining. Let me know your questions. It's always good to see all of you. Thank you for being so consistent in showing up. I also wanted to say, you've probably heard in the news lately that the first recipient of a pig transplant after 2 months died. It was likely that it was not related to anything with the kidney, but the details so far have not been in any large amount, so I'm not sure, but certainly it is discouraging, but it's nice to know that that is a possibility down the line as they perfect the art of doing genetic mapping in the pig transplants and providing that for patients. So we know that that's so much a need, and there's more to come on that. Question: when someone is told that they will eventually have to go on dialysis, do you suggest having a fistula placed in advance? Well, certainly if you are being told about your need for dialysis, make sure you have all your options. If you are sure you need that you will be, if you're sure you want hemodialysis, then yes, it's better to have your fistula placed in advance, and usually that will be coordinated with your transplant, with your vascular surgeon and your nephrologist. You don't want to put it too far in advance, but you do want to get your vein mapping and anticipate when they think you will need to be started so that you have time for that fistula to mature. And you want to make sure that the fistula that's placed, that will be able to be placed, because some patients may not have good enough veins, and when you anticipate a fistula, then they may end up having to have a graft placed. But that is where, once you have that commitment to hemodialysis, make sure you also have the information of whether peritoneal dialysis is an option for you before you commit to the fistula. Make sure that you haven't considered, that you've ruled out your options for living donor transplant. Do you have an advocate who can help you get those possible donors? Do you have someone who can, as many of us sometimes don't want to ask family and friends, you may want to say, okay, maybe I should have someone be my advocate. They can write the letters, they can do the asking, they can bring it up on social media they can advocate for someone to donate to you. So certainly look at your options for renal replacement therapy before you commit to one, so that you are well educated about your options and what's right for you as a person. I mean, so that you have all the information laid out and you're making a well-educated decision. So certainly it's good to have all that information under your belt so that you can make it easier to move through the process once you need to start dialysis. So thank you for that question. Heparin is from a pig and a cow. I'm happy with the advances in technology. Yes, we are definitely have advances, and so we're moving forward. I think there was a second transplant from a pig transplant done in New York, and that was with a pig transplant as well as an artificial heart device. So there certainly are many advances, and the more that's done, the more we're able to work out the kinks and see whether the issues are, whether it's infection, whether it's rejection, whether it's just patient comorbidities, things that same issues regarding transplant in general. We want to make sure we're transplanting healthy people. And maybe this, patients may have been sick enough and you know that they will not survive long enough, but it may be enough for us to gain important information about whether or not this is something that they can improve on. How long after being transplanted should a patient adhere to the their dietary restrictions for transplant patients? Remember at what point can transplant patients move away from the transplant diet? With every transplant, each patient will have different needs. There are people who are severely hypertensive, and we know that after transplant, we're going to say, continue to have your salt-restricted diet. But one of the advantages of the transplant, if it's successful, we will see a decrease in overall of the hypertensive medicines. But remember, early on after transplant, you're going to be on a lot of medications. You'll have a lot of fluid on board. And so depending on how well your kidney works, you will have restrictions. You will have restrictions in how much fluid you may be able to take in. But if your kidney is making a lot of urine, one of the things we have is that some patients can't keep up with the amount of fluids they need to drink, because now they're making 3 or 4 liters a day and they have to keep it with that fluid volume that they weren't able to do on dialysis, and so they can't drink that much. There are the patients who have issues with high potassium after transplant. Well, there are some that may not. So that diet doesn't necessarily apply to everyone. Some patients need foods that are high in phosphorus because now the phosphorus is low after the transplant. There are patients whose magnesium has to be supplemented. We give you magnesium pills when those things are different. And so it depends on how well your system is adjusting to that kidney and what is still abnormal after the kidney is in. So if your kidney is slow to start, you may have problems with blood pressure, you may have problems with high potassium. And remember, immunosuppression medications often will keep especially Prograf or tacrolimus, will keep your potassium a little bit on the higher side. So certainly it's not moving away from that transplant diet depends on what your main issues are, and those issues from one person to another may be different. So it's about adjusting that diet to suit your needs. Do I need less fluids? Do you need more fluids? Your phosphorus is low, and that's generally with most patients. Once the kidney starts to work well, you would get rid of phosphorus that's built up in your system, and now we're telling you we need to replace foods that are high in phosphorus. And that's a big switch from being on dialysis when you're told, no, don't eat this, don't eat that. And the same with potassium. Some patients, because of the metabolism of the kidney, will still have a high potassium. And now we're saying, oh, sorry, I'm going to have to put you on potassium-lowering medication. So it's very different from one to another. But thank you so much for your question. Thanks for everyone who's joining. Again, I'm Dr. Scanterbury. I'm the medical consultant here for Dialysis Patient Citizens Educational Center. This is your Ask the Doctor hour, and I see many of you are welcoming each other, and thank you for inviting others to the platform. Thank you, Jennifer, Yolanda, and certainly we want to advocate for those who are ambassadors and who have been attending meetings and are advocating for DPC, and also learn more about how to be an advocate. And as Yolanda said, you are your best advocate, and so you need to get information. Certainly, I agree with, we have the dialysispatients.org. Go to the website, join, get all that information that's there on the website to help you learn how to advocate for yourself. And if you have a loved one who is on dialysis or who's in need of a transplant or on the waiting list, it's also an opportunity to learn to make sure that you're doing the best to be informed, making sure that your transplant center is keeping in touch with you. If you haven't heard from them, reach out to your coordinator, find out what's going on, find out whether you've met all the requirements, make sure there are no tests that are outstanding that you were not made aware of, so that you can be in optimal position to get transplant. Nothing worse than having a patient call in a patient for a possible transplant and find out that they're not up to date, they haven't had that stress test that's needed on an annual basis, or they didn't complete their dental exam. So those are things that you want to make sure that you are aware of what's going on. So I want to say hi. I'm saying that our esteemed board member, Quiana Bishop, is here today. Thank you so much for joining. Thank you for your leadership, as Yolanda said. And it's exciting to see all you guys hanging here. Thank you so much. Again, I'm Dr. Scanterbury. I'm here with any questions you may have, any information you may want to further your journey, whether it's on dialysis, whether it's to being listed for transplant. And for those who have been transplanted, I want to congratulate you. I hope you're all doing well. I hope you're following your regimen, listening to your doctor, and doing the best you can to keep that kidney as long as you can. And as we said in one of our previous sessions, you know, different people, different patients, and the kidneys react differently. Some people will keep their kidneys for many years. Some people will lose their transplant in a few years. But it's all about what can we do to maximize that time, and how can we keep your kidney from rejecting. Sometimes it's not under our control, but we want to make sure that we are getting our labs checked, that we're keeping up with our blood work, that we're keeping up with our physicians, and getting those monitorings, blood work, so that we know what's going on. What is the best approach a patient can take when feeling unheard by the healthcare professionals? And so I think depending on the situation, it's important to find out what the issue is. Sometimes it may be going to the next level in terms of saying, well, our communications here are not the greatest. Is there someone I can speak to? Because I feel like we're not getting anywhere. So you may want to certainly move it up to the administrator, the manager, the person in charge above who you are, to make sure that you have that relationship, or you can improve on that relationship. And as I said to patients, I mean, we oftentimes, if you're not pleased with your healthcare professional, just remember you have choices in who can take care of you. It's your insurance is paying that physician or healthcare provider. So make sure you have a good relationship with them, and that they're listening to you, and you can feel like you have a role or play a part in the decision making. So you want to have that two-way street. And it's hard sometimes for many patients, because they sit and they listen, and oftentimes for patients on dialysis, or even for kidney transplant, that we get tired of being told. They tell me what to do, they tell me what to eat, when to get up, when to do this, I have to do this, I have to do A, I have to do B, I have C. But what role do I play in getting that stuff done? Or why is it necessary for me to get that stuff done? So you may want to ask more questions of your doctor or your healthcare provider to find out tell me more about this. What are the disadvantages? What if I miss my treatment? What are the things that I can do to make me more compliant or to help me get there? So where do patients turn when due to staff shortage? It's hard to speak with social workers at the dialysis center. And that's a tough one. That one I'm not sure I have an answer, because even for our patients, social workers are spread thin amongst the dialysis patients, because they're not assigned to one unit, and so they are often across the board covering more than one. But we do have the networks that are within your own network. So you may want to reach out to your regional network leaders to see whether or not there's something could be done based about your issues at your particular center. So yes, reach out to the network that your dialysis center is under, so that you can figure out how you can be better served. So it may not be the correct answer, but that would be where I would go from there. Thank you so much for that question. Welcome, Denise. Thank you all for joining. Again, welcome, Cheryl and Cherise. I'm Dr. Scanterbury. I am the medical consultant for dialysis patient citizens, and we are here with the Ask the Doctor Hour. Another question, it's a younger patient and she feels as if they aren't taking her seriously. Definitely you want to, sometimes it's best to sit down and have a conversation, or have a conversation with, if it's a younger patient, maybe there's someone there to represent her as well, so that you can have that conversation with a healthcare provider, so you can make sure that you never want to be dissatisfied with your care. You want to be heard. Everyone wants to be heard, and you want for folks to say, because many patients feel that they know themselves better and they've been living with themselves for a while. And oftentimes the here's what I want you to do may not often sync with what you have within your own, what you feel is best for your own body. I'm not sure of the situation, but certainly we want to be able to make sure that you can have a conversation that's best for both sides. Again, I'm Dr. Scanterbury. We're coming up on the hour, about 8 more minutes to go. Let me know your questions and anything I can help you with. Whether we talked about earlier, previous session, about being waitlisted, understanding that some people get discouraged because you get all these calls and often that don't go into the transplant. But understand that if you're waitlisted and you're waiting for a call, you can be number 4 or 5 or 6 down the list. The transplant center will call to make sure you're ready to go. They may even do your cross match to see if you're compatible. But basically you can remember, for each donor there may only be 1 kidney or 2. Sometimes many of the kidneys go with the more important solid organs. So with many donors, if the donor is a heart donor, oftentimes that heart recipient needs a kidney, so a kidney may go with that heart, or the liver recipient may need a kidney, and so they get priority. And so for many donors, there may only be 1 kidney left to distribute, because the other, whether it's the pancreas, whether it's the heart, whether it's the liver, they can have dual organs from the same donor, and they get priority over the single kidney recipient. So that will often decrease the amount of kidneys that are available. So if you're a number 2 and you're thinking you're getting a kidney, and then that kidney goes to the heart recipient, then you feel quite disappointed. But we know that once those above you are eliminated, hopefully the next time it comes around, you will be up on the list. So thank you. My blood pressure is constantly dropping while I'm on the machine. Why is this happening, and what can I do to correct this? Certainly it depends on what your underlying issues are. Certainly if you're diabetic, if your volume is low, depends on whether you have underlying heart disease, but there could be a lot of things that's causing that. And so that's something you need to discuss with your healthcare provider, and those who are dialyzing you. Maybe the volume or even the pressure at which is pulled, or underlying issues with your cardiovascular system is usually the things that we would want to investigate to make sure that there's not an issue there for your blood pressure. Remember, at a certain point in dialysis, a whole lot of your volume is in the machine and not in your body, and so it's circulating out. So that oftentimes will have to be supplemented to keep your pressure down. But certainly talk to your healthcare provider to figure out what they can do to help you from dropping your blood pressure to low volumes. And certainly, as Yolanda said, we want you to certainly join DPC just to be a good support system. You certainly will have people, you would hear what others have gone through. You will be able to know that you're not alone in your struggle, and that there are issues that you may be facing, that they're either stories or experiences either on social media, whether it's the Facebook page, the Instagram page, or even the online page. There are stories that are shared by so many people who've gone through the process that you may feel empowered and you may feel hopeful that you're not alone on this journey. So it's certainly important for you to join the membership of DPC and learn how to be a better advocate, speak up, ask questions, and so that you can optimize your health overall. How can a patient advocate be beneficial to nephrology, or a bridge between patients? How can a patient advocate be a bridge between patients and physicians? I think certainly many patients feel intimidated by their physician, their nephrologist, and often the time that they're there, there's just not enough time maybe to ask the questions that they want to ask. And this is where I say sometimes it's best to keep a little notebook and write these things down, so when you see your healthcare providers, you can pull it out and ask those questions. A patient advocate can be better in terms of explaining to the physician what your issues are in a way that they could understand, and often calling on them to get their attention and be that bridge. Yeah, they can certainly be a bridge, but unfortunately, one of the things that is important is to try to figure out, is there such a person in your dialysis unit that can be that advocate in terms of being, and if it's not someone in your unit, maybe it's a family member who can advocate for you, who can explain your issues and who can verbalize the concerns that you may share that may not be, that you may not be able to voice on your own. So I think advocates are definitely, we have them and we try to promote them for patients who are going through the transplant process. Melissa says she is a patient advocate for our healthcare system, and it is her job to make sure that the questions and concerns of the patients are addressed. And they can be upfront with the physicians, and that's their role. That while you may feel intimidated, they have the gusto and the grit to go and say, this is the patient concern. Can we talk about this? Can you sit and talk to the patient about this? And that is something that's needed. And we need to have like an advocacy course where we teach people how to be advocates, how to advocate for themselves, and how to advocate for their loved ones. Thank you, Melissa, for all you do. I think that's probably a session that we need to talk about how we can be better advocates across the board. So, half an hour, 30 minutes have gone by so quickly, but I thank you for being here. I thank you for all your questions. Thank you, Yolanda, for being in the background, trying to encourage others. And if you appreciate these chats, Jennifer, please invite others to be here, and so we can have the conversation. If there's topics you want for me to address, there's so much stuff in my head, I don't know oftentimes what to talk about, but let me know. Great resource, and was truly an incredible advocate for her dad. You absolutely, Melissa, maybe we can have a session with you to talk about advocacy. So thank you all so much. Have a great day. God bless.